Healthcare workers and educators were hoping for a boost in funding in the Ford government's fall economic update. But there is no new money coming for schools or hospitals, despite what sector workers describe as chronically underfunded institutions.
There's no question that education needs investments.
But in the Ford government's mini budget, new investments are being made in infrastructure and supports for businesses hit by tariffs. The union representing elementary teachers says students are being neglected.
These little kids are struggling right now. They're hurting. They've got needs that are not being met, that our members are not equipped to deliver to these young children. They need more, and they're being ignored.
The education minister's office argues the claims made by the union are false, noting they increased education funding for the school year to $30.3 billion, including a 36% increase for special education, calling it a record investment. But opposition leaders call it chronic underfunding.
If any parent out there is hoping that their child is going to have a smaller class size or any support increases in classrooms, this is not the budget for them. That's not coming.
Instead of more money, the education minister's office says it is reviewing school board governance to ensure accountability. Paul Calandra has already taken over 5 Ontario school boards and replaced trustees with government-appointed supervisors.
No meaningful support for our schools and no investment to stabilize our hospitals.
Hospitals, too, will not get any new money, despite the Ontario Hospital Association's plea last month for another $1 billion to meet the sector's full revenue needs.
We're now going to need to shift gears and actively start to plan to operate with more limited resources.
What's that going to mean for patients, for healthcare workers?
There will be trade-offs, and this will be a very challenging time for the system, for the sector.
The health minister's office argues it increased hospital funding by 4% for a third consecutive year. Not enough, we're told, to keep up with demand.
We have, more people using the system. The medical needs are more